Yeah, it is indeed my honor and great pleasure for me to introduce international speaker Dr. Sai Krishna Gudi. Dr. Sai Krishna Gudi is, of course, a student of Dr. Suresh sir. And what I understood by looking at his biodata or resume is that he's a passionate learner. That comes out, very strongly when you see his biodata. I was very happy to see that. He has completed his B Pharm from SIMS, Pharm D from JSS, and his MS from College of Pharmacy, University of Manitoba, Canada. And currently, he is doing his PhD at College of Pharmacy, University of Manitoba in Canada. He has won several scholarships and awards. He is the recipient of Pharmacy Practice Contribution Award by Deccan School of Pharmacy, Hyderabad. Then CPHM William G. Erner Graduate Scholarship Award in Pharmacy by University of Manitoba, and the International Graduate Student Entrance Scholarship again at Manitoba. Best Student Award of the Year award in LIC. So like this, he has won several scholarships and awards, which is definitely laudable. He has participated in around 25 poster, 15 oral and 3 e-poster presentations. He has attended 60 conferences, seminars and workshops at both the national and international level. He is a renowned and welcomed keynote and guest speaker at national and international areas. He has several certifications which you can see. Just one of them is a pharmacoeconomics from the Utrecht University. He has also got another one from the principles in epidemiology. He has several certifications. Why I am highlighting this aspect is that I consider it important that everybody has a learning attitude. And reflecting that learning attitude is all these slides which I'm representing of Dr. Sai Krishna Gudi. So over to Dr. Sai Krishna Gudi. So as you are aware, you can just press the next button. We are already crossed 200. You can please start your presentation. We are all ears, sir. Thank you for coming over live from Canada.
Sure. Thank you so much. It's all my pleasure. Can you just share my slides so that I can go ahead?
No, slides are already on. You just press next. You come to this. Okay. You just keep pressing next.
Fine. Perfect. Hello, everyone. I hope you all are doing well and staying safe, especially during these unprecedented times. Also, I thank Sunil sir for such a wonderful introduction and all the participants for your interest and showing up in this webinar today. Before starting with anything, I would like to thank our College of Pharmacy and KRPA for providing this opportunity, sharing my thoughts and views regarding telemedicine in the era of COVID-19. That is the topic of today's session. It's always such a pleasure to share my screen or my session with such a optimistic example or a role model that is Suresh sir for such an young pharmacist, budding pharmacist like me. So without further delay, let's dive into our today's topic, that is telemedicine in the era of COVID-19. So when I was asked to speak about impact or importance of healthcare technology in the field of pharmacy, I was wondering what topic to choose, and thus telemedicine has struck my mind because these days it is gaining a lot of reputation, and it's a booming field. So I thought, why can't I go with this topic, and that's the reason behind choosing this topic for today's session. So let's get started. I don't have any potential conflict of interest with regards to this presentation or slides. As always, I would like to start my presentation with this statement, that is, the views and opinions expressed in this presentation are completely of my own, and they do not reflect any official position or policy. So starting off with today's learning objectives, end of this presentation, each participant or the delegate, whoever is attending today's webinar, will be able to outline the healthcare system in India, know what, why, how the telemedicine is, articulate the process of telemedicine, that what apps we'll be using and what are the key features of telemedicine app and how exactly it looks like, and what are the steps involved in it, and what are the types of telemedicine consultations or are being available today. Also understand the importance of telemedicine, especially during the current pandemic, that is COVID-19. I request delegates can just off your video so that I can see my slides clearly, because it's just popping up on my slides and I can't see the content. Yeah, okay, sure, that's fine. Yeah, thank you. So also the participants will be able to identify what are the facilitators and barriers that are associated with telemedicine. Lastly, I would like to conclude today's session by listing out some of the pros and cons that are associated with the telemedicine itself. So just to start with healthcare in India, you might be wondering what's the relation between today's topic, that is telemedicine, and why I'm talking about healthcare in India. Because just looking at these important numbers and some of the facts, it actually give you an essence of uh, why telemedicine is important in this current scenario, especially in developing countries like India. That's the reason I first wanted to emphasize a bit on how exactly the healthcare system is in our country, that is India. So if you look at the first point, that is around 70% of Indian population live in rural areas. That is like majority of us, like majority of Indian population at 1.3 billion. 70% of the population reside in rural areas, leaving just 30% to the population residing in the urban areas. India with its vast population India, with its vast population, it has uh, reached in-hospital terrains along with inadequate healthcare networks, facing a daunting challenge for providing quality healthcare to its citizens. So 90% of secondary and tertiary facilities are in cities and towns. I hope most of the participants might be aware of what exactly is secondary and tertiary care facilities. There are basically three types of care facilities. There are primary, secondary, and tertiary. Basically, we can differentiate these based upon the services being offered. If you look at the primary care facilities, they are just like basic primary care or primary health care facilities that are being available. And if you come to the tertiary care, these are like specialized and subspecialized areas where which includes the regional and something like at a broader range, like specialists, or cancer chemotherapy, or heart transplants and all are being called as tertiary care. So around 90% of these secondary which is also known as subspecialty, or tertiary also known as specialty facilities are in cities and towns, but not in rural areas. Also, there exists a low penetration of healthcare services in India, meaning there are certain disparities in distributing of these healthcare services equally among urban and rural areas or populations. And there exists a lack of investment in healthcare in rural areas. Still, the world is growing, and we are just witnessing a lot of things. The world is developing, but still, it's not just in India. In majority of the countries, the government and the policy makers are still lacking behind in distribution of these healthcare facilities, or dispersing these healthcare facilities equally among rural areas and urban areas. Moving on to inadequate facilities in rural areas, that's what, as I mentioned, most of the rural areas, especially in India, they're lacking even primary healthcare centers, which is a bit concerning. So lastly, a problem of retaining doctors in rural areas, especially the specialist doctors. It's just a common tendency for any individual, that might be a specialist or a general practitioner or any healthcare professional, to reside or to take an initiative to sustain or to serve the community in the rural areas for a wide variety of reasons. But still, I'm just not blaming Indian healthcare system or Indian government. But still, even for example, for instance, if you take even in Canada, most of the rural areas, or suppose most of the Northwest territories, it's the same situation or the same scenario even in developed countries like US and Canada. Most of the physicians or the doctors, they don't like they don't like to immigrate or move to a rural area and serve the people. So that's the problem and difficulty we are facing. So let's move on. And if you look at some more quick facts about our Indian healthcare system, as I mentioned earlier, Indian healthcare services are highly skewed in favor of urban population, meaning that I might not say they are being biased towards urban population, but still, it's like it's in a lot of favor of towards urban population rather than when compared to rural population. Despite they, even they are just they consist of 28% of entire Indian population, that is urban population. So population deprived of primary health care is around 700 plus million in our country, that is India. Meaning there are 700 million people or individuals which are not having enough medical or healthcare facilities, and thus they are deprived of these facilities, primary healthcare facilities. Forget about it, about a subspecialty or specialty or higher end hospitals or the services, but still even they are unable to attain to getting the primary healthcare services. Specialist healthcare providers in urban areas are around 70%. As I told, despite the fact that the urban population or the individuals comprise of just 28% among Indian population, however, 70% of the specialists are residing in urban areas. And if you look at the number of doctors that are being available per thousand population or the individuals, around 3 doctors are available per thousand individuals in urban population. I mean, in urban areas, whereas it's not even a single doctor or a single person per thousand rural population or the rural individual. So all these things will sort of walk you through the directly or indirectly, it shows or it states the importance of telemedicine. That's the reason I just started my presentation by giving you some of the facts and numbers of our current healthcare system. So just starting with our today's topic, that is telemedicine. So what exactly telemedicine is? Telemedicine, if you use any sort of telecommunications, that might be information technologies or any apps or web-based programs in order to deliver healthcare services, that is telemedicine. So the definition, according to WHO, it says use of telecommunications and information technologies, that is IT, to deliver the healthcare services is known as telemedicine. Uh, further, if you go beyond the beyond this definition, it is nothing but just exchange of health related information, that might be patient diagnostics or patient vitals or patient demographics or their socio-economical status, whatever it might be. The exchange of health related information of patients using electronic communications with an intention to advance the health of individuals and their communities. So all putting all this all together, it is known as telecommunication or telemedicine. So why telemedicine? As I just mentioned you in my earlier slides, I mean in the starting slides, it's very clear that we have observed the shortages of physicians irrespective of urban or rural areas. There is a disparities of distribution of healthcare services among rural and urban areas. So that would be one of the reasons why telemedicine is being, or it's playing an important role in our current healthcare system. Moving on to the second one, that is distribution of expertise. As I told, there are a lot of disparities, and the government or the policymakers are a bit lagging in providing the equivalent distribution of expertise like specialists or the GPs among all the population, including rural and urban areas. Basically, telemedicine is proved that it is very cost effective when compared to inpatient or in-person consultations. Telemedicine is a bit cost economical. So that might be one reason. Other reason would be actually patients like it. There is a lot of studies that are being conducted, and most of the studies inferred that actually patient likes to be consulted his or her doctor or her GP using telemedicine, and there is a lot of satisfaction among patients using telemedicine. That might be one major reason why telemedicine is just drawing all the attention these days. Last but not the least, the most important thing is it actually works, right? So there is one paper that was recently published, and which actually looked at the differences in quality aspects between providing care in person versus providing care, healthcare facilities through telemedicine. And it didn't find any significant difference in their results, which means it's actually working. Even it could, in some instances, it could even work better than in-person consultation. So all these reasons, make telemedicine, more much booming or prospering these days. So how does it work? Basically, as I told you, we can usage of any telecommunications or health information technologies is known as telemedicine. It could be conducted through a web or a mobile app, which actually could help patients. They can request the visits by submitting their details, and they'll have a provision of explaining or providing their signs and symptoms over a video chat or online messages. So this is how exactly it works, and thereby doctors can actually diagnose what exactly the patients are being suffering from, and they can note down the essential data. If required, even they can prescribe or order some of the medications through telemedicine services. So what are the primary goals of telemedicine? What are the major purpose of telemedicine? Just remember, as a thumb rule, just remember two things. If someone asks you like what are the major goals or the purpose of telemedicine in the current era, uh, you can just say a couple of things. The first one would be just to provide the access. The first and foremost goal of telemedicine is to provide access to the healthcare services to the public, and the second one could be to provide the quality healthcare to the public. So quality and access aspects are chief goals of telemedicine, as Suresh sir has mentioned in our in his inaugural speech about the access of healthcare facilities and about digitalization. He already touched base on these things. So that's what my entire talk is about. So the goals are like make healthcare services available and accessible to the public, and to increase the quality and continuity of care. Thereby, on overall basis, it is increasing the patient's clinical health status. So these could be the goals of telemedicine. Let's very quickly have a look at the telemedicine app, like what are the features it has, and how exactly it could be used by the patients. So to book an appointment, patient can browse through a wide variety of doctors or the GPs that are being available in their cities or towns or in their areas. Also, they have each and every telemedicine app almost has all these features, like patient registration section, where patients can actually type in their details in order to book or register their consultation. They also have the provision of searching the doctors or the GPs or even specialists using the telemedicine app. They'll have wide variety of doctors that are being available, so they can choose which doctor they want to see for their consultation. Thus, thereby they can book an appointment with so and so person or a physician. And they'll also have an option of payment and subscription to that particular physician or that particular service or that particular healthcare facility. Lastly, even patients will have a provision of providing reviews or ratings to that particular physician or that particular agency or the app itself to come up their views. So More or less, each and every telemedicine app will have such facilities in general, which I wanted to emphasize on. So types of telemedicine consultations. So what are the types of consultations that are being available using telemedicine is the first one would be live or interactive video consultation. This means where patient and his or her GP will go hand on hand in a video chat, where it's pretty similar to what we are exactly doing right now. I'm just sitting here and speaking with all of you using a video or a webinar session. It's a live interactive session. So it's the same way. Patient would be explaining his or her symptoms to his GP in a live video consultation. So that is known as live or interactive video consultation. It is also known as synchronous type of consultation. Basically, most of the patients who wants to see their GPs, that is general practitioners, would opt for this option. And moving on to the second type of consultation, that is store and forward consultation, meaning it is not a live telecast, or there will be any live interaction between a patient and a physician, but still patient will be able to make a video and save it, and he or she will be forwarding or sending it to his or her GP, who he wants to be treated by. So that is the second option, where actually they will just make a video and then forward to so and so person to just go through his medical status. It is also known as asynchronous type of consultation. Yeah. Basically, if I wanted to exemplify, patients with the dermatological problems, where they actually want their specialist to look at the rash or any reaction or allergic reactions, they might be taking pictures or photos or videos, and they'll be sending on to their physicians to have a close look at. So that could be a classic example of store and forward consultation. Other one would be hybrid consultation, meaning it's a mix of both live video consultation with store and forward type of consultation. So you might be wondering what's the purpose of mixing up these both and being called as hybrid consultation. For instance, to make it clear, suppose you booked an appointment with a GP, that is general practitioner, who is not a specialist, and you are in a live video chat. You are explaining your symptoms, signs and symptoms, and your history and all such stuff to your general practitioner. In most of the cases, the GPs would be able to take the decision just by looking at your signs and symptoms, but in some special circumstances they might need the reference from other specialists like cardiologist or diabetologist or psychiatrist or dermatologist. So in such scenarios, the session will be recorded, and then apart from the GP, the session or the recorded video will be stored and forwarded to so and so referral or so and so specialist. So this is known as hybrid consultation. Last one, that is known as remote monitoring. So in this type of consultation, actually your particular GP will be monitoring your disease status or disease condition without you being interacting with him or her in a live, or you being sending him or her a store and forward consultation, meaning he might be surviving your vitals or your current disease status by digitally, by it's like being in his clinic or her clinic. They can actually know what exactly your blood pressure is, or your fasting blood glucose levels are, and how well you are doing and how well you are keeping up with. So this is known as remote monitoring, patient remote monitoring services, which is one of the most important types of telemedicine consultations. So moving on to the next slide, that is for what services telemedicine is suitable, or why, for what services it is appropriate for. Basically, observations of general appearances, as I told you, any sort of physical appearances, because most of the telemedicine services are being offered in a video chat rather than just chatting or in a audio call. So the GP will be able to look at your physical appearances, whether that could be a rash or a pallor or flushing or whatever it might be. So all the general appearances could be seen using a telemedicine service. Moving on to the temperature monitoring with a home thermometer. So that is pretty straightforward. That is just being measured your body temperature. Identification of general symptoms, that could be cold, cough, sneeze, vomiting, and headache, which could actually be identified, or which could actually be seen through a video or a virtual service. So all such type of services could be offered using telemedicine. Also, subspecialty consultations could be provided using telemedicine. That is, if you wanted to refer to a dermatologist or gynecologist and psychiatrist. I just mentioned these three examples because telemedicine is just taking its leap in among these three specializations, particularly dermatology, gynecology, and psychiatry. Also, nonetheless, using telemedicine, GPs could be able to order or prescribe their patients with their medications, where they can just order the medications based upon their chief complaints or the interaction which they had. So for these services, overall, the telemedicine is appropriate. So now let's look into what are the services that telemedicine is not appropriate for or not suitable for. As I mentioned, it's just a virtual services being offered through telemedicine. Obviously, it's a common sense that the lab parameters or imaging services could not be offered using telemedicine. That is, if they want to draw your blood samples, or if they want to take out your CT scan or something, it could in majority of the cases, until and unless you have an advanced technology or advanced machinery at the patient's side, it's not possible to do that. uh, Moving on to ICU visits, just remember one thing: these telemedicine facilities are majorly being embedded or applicable to to tackle the general scenarios, or on day-to-day or daily basis follow-ups, but not ICUs or emergency visits or trauma cases, which is not suitable for. Also, any sort of procedures like injections, or if you want to put in inject an IV cannula, or this type of any sort of procedures might not be suitable using telemedicine. Lastly, diagnosis is, it's not like it's impossible, but it is possible, but it might be challenging at times, or oftentimes it is a bit challenging for GPs, but it's not impossible. So these are some of the services that are not appropriate using telemedicine services. So how can this telemedicine be beneficial? As I told, through my talk, you might be getting an essence of what and how the telemedicine is being beneficial to the public. As I told, it could provide with the access and the quality healthcare services to the public, meaning it is bridging the gap between people and their GPs, or people and their with their healthcare facilities or health systems, enabling everyone to stay at home, especially during these COVID-19 situations. It is enabling everyone, especially symptomatic patients, to stay at home. Thus, it is reducing the spread of virus. Also, telemedicine at present is mainly used for non-invasive, non-surgical diagnosis. As I told you earlier, any sort of ICU visits or emergency and trauma facilities could not be offered using telemedicine services. So all sort of non-invasive or non-surgical things only could be offered by telemedicine. The most important thing is, as I told in my earlier slides, it is cost effective. I mean, it's cost economical, meaning it is enabling the public, financially viable to non-insured, and especially to the poor people. If you take countries like developed countries like US, Canada, Europe, people or individuals who are residing in these countries, they must have the insurance. If anyone doesn't have insurance, they are just like out. They are not even majority of the services. They, first of all, they will not have any eligibility of seeing their GP or seeing any sort of healthcare professionals. He or she must have the insurance. So this telemedicine is making people viable to non-insured and poor people, which is really a good thing. So now let's look telemedicine in the aspect of COVID-19. As I told, it's really important to respect social distancing measures, especially during the pandemics like COVID-19. And I hope all the participants might aware of what's the difference between quarantine and self-isolation. But still, this pandemic has forced us to quarantine and self-isolate ourselves in order to prevent or contain the further spread of this disease. In such circumstances, telemedicine has evolved as a game changer, you can say, or a global solution, where basically, as I told you, it involves the remote diagnosis, meaning it could be done virtually, like how we are able to, or how we are being connected through a webinar virtually. In the same way, patient and his or her GP could be connected virtually, meaning it's a remote diagnosis and providing the healthcare facilities remotely. Thus, it ensures social distancing and thus prevents the transmission of the coronavirus. Thus, telemedicine has evolved as a global solution to provide access to quality healthcare services. Also, as I told, it's a lot of research has been conducted, and it inferred that telemedicine is like a bit cost economical or cost saving when you compare with in person or inpatient consultations. And also, apart from that, it could save a lot of cost on your antiseptic material. Suppose during these days, if you wanted to visit a doctor, just forget about visiting a doctor. If you want to just step out of your house, you need to take all the necessary precautions, or like wearing a face mask or hand gloves, or sanitizing yourself, which might if you use telemedicine, through telemedicine services, all these actions could be prevented, and it is saving a lot of cost, which is also termed as green impact of telemedicine. So what are the facilitators that are actually driving these telemedicine services, to reach its importance, or uh, to reach its importance in countries like India? As I told, it's low cost and wide reach is one of the major reasons why telemedicine is moving right now. And lack of disease management frameworks, that is, it doesn't need a lot of disease management frameworks where patient has to go through all the diagnostic steps and going through giving the lab parameters, and seeing a lot of doctors, and thus finally going to meet a particular person where he wants to meet. So especially in countries like India, so these factors are some of the facilitators that could act in the process of facilitating the telemedicine. Also, lack of healthcare facilities, as I told, in far off regions, or the remote regions like rural areas. Okay, now we have seen what are the facilitators, and have a very quick look at what are the real-time challenges we have or we are facing with telemedicine. It's very natural tendency for any individual, if he or she, suppose if I or you met with an accident, or suppose if not with an emergency or trauma cases, even with a small complaint or sign and symptom, we directly, our mind will directly tend towards a typical or conventional way of approaching a doctor, that is just booking an appointment and seeing in person. But at the time of a need, that's what the whole sentence is talking about. At the time of a need or emergency, most of us will revert back to what we are used to, that is just meeting our GP in person. But we will not even get a thought of seeing our GP virtually or through using any web-based services. So that might be one real-time challenge that telemedicine is currently being faced. Other one could be patients would prefer to see their own providers. Okay, even they are adhered or habituated to use to telemedicine services. Even in telemedicine services, most of the patients want to see their GP or their general practitioner with whom they had their previous exposures or encounters. They might not be comfortable seeing a new physician or a new general practitioner. So that might be one real time challenge, because at times all their GPs might not be available, or they might not be offering their services in telemedicine except inpatient services. So that could be one real time challenge. The last one would be patients might be really unaware of that telemedicine exists, And even though some of the patients or some of the individuals know that telemedicine services are there and they're being covered or insured for telemedicine services, they don't actually know how to access it or how to use it. So these might be some of the most important real-time challenges faced by the patients using telemedicine, which I wanted to highlight here. Okay, then how to overcome these real-time challenges or barriers that are associated with telemedicine? The one and only way could be educating the public or the people or individuals with saying that telemedicine could be as effective as the in-person or inpatient consultations. It could be an effective alternative, especially during situations like COVID-19, where a patient cannot step out of his or her home and see their GP. And expanding network reimbursement coverages, government has to come up, they have to come forward in providing the reimbursements and coverages or insurance to the public as well as the physicians. And it should encourage physicians to provide their services using telemedicine by expanding their network reimbursement coverages. That could be one way of dealing with these real-time challenges. And lastly, continuing to reduce cost barriers in accessing telemedicine. So as I told, policymakers and all these healthcare decision vendors, stakeholders, and the government should take an active part in in minimizing the cost that is associated with telemedicine. So we almost came to an end, and just very quickly look at the what are the pros of telemedicine. What are the advantages that are being offered or being associated with telemedicine? The first one could be the access. As I told, the primary goal of telemedicine is to provide access to the healthcare services, and the second one could be to provide the quality healthcare services. So and also, as I started my session, starting with a slide showing that healthcare services or healthcare in India, where there is a lot of disparities between the access to urban versus rural population. So the pros of telemedicine could be to enhance the access and availability of healthcare services to the public. That could be the major, and it could be in the first place. The second one could be early diagnosis and treatment. Suppose, for example, in most of the developing countries, especially, since we're talking about the Indian context, most of the patients, I don't say most of the patients, but out of my experience, I can speak, patients are not interested to go and visit their GP or visit a doctor and to talk about their signs and symptoms or to disclose about their disease status. It might actually delay the diagnosis of their condition. So using this telemedicine app, that might be a wide variety of reasons could take part in this process, because they might be very lazy, or they don't want to go out, or they don't want to take a bus or travel to a physician, or they don't want to wait a lot at the physician doorstep, a lot that might be a waiting times. So a wide variety of reasons it could be, but still, using this telemedicine app, just by sitting at their home, they can have access to their GPs, where they could have been diagnosed early diagnosed with their conditions. Other one would be reduced physician fees and cost of medicines. Also, I don't say this is a common trend everywhere, but still, suppose, just imagine if a patient visits his or her GP, general practitioner, or any doctor in person, and suppose you just visited your doctor and he or she they did not prescribe you with any medications. Just by looking at your signs and symptoms, they just told, it's like a normal fever or normal cold, will not prescribe any medications, and then told, take a steam, or just take care of yourself, and within a couple of days you should be normal. If you do that, we will be having a perception of, why he didn't he does not prescribe any medications to me. And there is some sort of misconception, especially among our Indian public, that the doctor who prescribes more medication will have a more knowledge, or he's more concerned about your disease or something like that. So doctors are forced by the public itself to prescribe or to put them on medications like pantoprazole, which is also called as a candy or a chocolate. The patients are put on the pantoprazoles, or paracetamol, or some other, or B complex tablets, or whatever it might be. So Actually, this telemedicine could reduce the cost of unnecessary medications. So that's what I wanted to convey here. As I told you, it reduces the travel expenses. As I told, you need not even step out of your door, and you need not meet your physician by traveling all the way. So thus, it is traveling or saving money to a patient. Reduce burden of morbidity. Suppose this could be explained if you just visit your GP and state your symptoms in certain situations. GPs could not take a decision of saying that okay, you can just go home, and they're not attempt to just prescribe you some medications and take these, but they want to observe you under observation or something, and they ask you to stay at the hospital or to admit in the hospital. So through this telemedicine app, you can actually get connected, stay connected with your GPs. In that way, it actually reduce the chances of admitting into the hospitalizations or the morbidity. Moving on to the next one, that is timely follow-up. Especially talking about this telemedicine, it is quite aptly appropriate with the follow-up of discharged patients. It is really good to, if any GP wants to follow his or her discharged patient, this could be a really great way. Other one could be specialist referral services. As I told you, your GP could refer you to any specialist like dermatologist, psychiatrist, cardiologist using these telemedicine services, which is one of the advantages. Remote patient monitoring. As I also mentioned in my earlier slides, it is something like where your GP will monitor your signs and symptoms or your normal vital signs just sitting in his or her cabin using a device. It's like a surveillance system. You need not do anything. He might be observing all your health conditions of the status, that is known as remote patient monitoring. Acceptance of the disease. Suppose, for example, again, in developing countries, patients have tendency to not. They have tendency to, they have something like stigma, or they'll not openly accept, they'll not be in a position to accept their disease if they are seeing if they are visiting their GP in person. Suppose if a GP tell to a patient like you have been diagnosed with so and so disease or so and so disease in front of a nurse or other healthcare professionals or something like that, they might not be in a position to accept it actually because of the stigma or something. But if it is in a via through telemedicine, they could actually, the rates of acceptance of a disease among patients or the individuals would be high using this platform. And lastly, it promotes the medical education. Just not all these pros are related to the patient, but if you look at from the general practitioner or healthcare professional aspect, it actually improves the medical education among the healthcare professionals. They'll be trained how to use telemedicine and what are the recent advancements, and they'll be equipped themselves in order to get better assist the patients using these digitalized networks. So these are the some of the most important pros of telemedicine, which I wanted to share with you today. This is my last slide. That is where we look at the cons of telemedicine. That is disadvantages or challenges. You could even call barriers or the limitations of telemedicine that exist. The first and foremost place, it could be patient privacy. So if suppose, as I told, there are four types of consultations through telemedicine. The second type is just to store your video and forwarding your video to various types of GPs or specialists, where especially in India, most of the patients will have they have privacy and confidentiality issues. Suppose if your doctor asks you to take a video of your condition or something like that and share it to him or his clinic or his assistant or his nurse, we would have some sort of privacy issues. Okay, my disease condition might be revealed or might be misutilized, or might be, I'm just sending out of my personal my personal this thing. So though the patient privacy and confidentiality might be one major issue with telemedicine, where actually patients have to be educated a lot. The next one would be lack of trained manpower, as this entire process is equipped or tackled with a lot of digitalization, where it requires manpower, just not manpower, but people with intellectual minds in order to deal with these technical issues. It needs a lot of manpower. And the next one would be internet availability in rural areas. As I told, the major goal or advantage of telemedicine is to provide access to the people who are residing in rural areas or remote areas. But the at the same time, the other the you might be wondering, most of the rural areas or the villages, they might not have the internet facilities or any telecommunications or information technologies. So that might be that could be one limitation, especially in countries like India, where we don't have high bandwidth internet facilities. Other one would be
So,
patient.
Dr. Sai, I think there's a queue here. Okay, right.
Okay, just
Yeah,
last 5 more minutes, maybe two
yeah,
more minutes.
yeah.
So the next one would be patients' fear and unfamiliarity. As I told, they might not aware of the telemedicine facilities, or they might not know how to use it. So that could be one disadvantage. Financial unavailability. Although I told telemedicine is cost effective or cost economical, that might be in terms of just visiting or seeing your GP. But in order to set up a telemedicine setup, you might initially you might have to put some of your money out of your pocket by establishing, like internet facilities or laptops or computers or whatever it might be. So it is associated with some financial constraints. Lack of literacy, as I told, most of them are unaware of the facilities. And the next one would be diversity in language and culture. The culture barriers are most predominant in especially in the era of telemedicine. Quality aspects, government support and reimbursement. Government should come up in supporting the doctors as well as their physicians by providing reimbursement and coverages in form of insurance. And perspectives of medical practitioners. All medical practitioners might not be in a position to accept the services that are being provided by telemedicine. So that could be one con. And licensure and regulations. Basically, these the GPs in states or in Canada, they are it's like by provinces or states where you cannot actually see a patient from another state. So that could be some of the regulation limitations. The last one could be GP training and acceptance. As I told, all the GPs or the doctors might not be accepting the telemedicine as such. So that these all could be some of the cons of telemedicine, which I wanted to highlight. And the take-home message is, as I told, telemedicine could improve the access to the people in remote areas or the rural areas by providing the quality healthcare services. Thus, it is very cost efficient and cost economical, which actually meets patient demands. By all these explanations or giving all these reasons, I could say telemedicine is indeed the need for the hour. Just remember one thing: telemedicine is a process, not an event, which actually a government or any person can right away or overnight can implement these services in their state or in their country. But it's just a steps of process, which includes a lot of teamwork from all the IT vendors or stakeholders or healthcare policy decision makers. So that's all I have, and I here end my session, and I'm open to any questions if I have. And you can also reach me personally if you want to discuss any sort of professional discussions through my provided information. So thank you so much.
Thank you, Dr. Sai. It was very illuminating and very patient. You have given a very in-depth knowledge on telemedicine. A lot of questions are there. Plenty of people have asked. Dr. Rajshekhar, Ruchika, Disha, Grishma, Prabhudev, Vishnu Sai, Abhishekta, then Vajravelu, Lavanya, Rehana, and Reshma. So a lot of people have been listening intently to you. Okay, the first question, you can give short answers. Okay,
Sure.
the first question is it possible to understand all the symptomatology with the help of telemedicine? Will it not lead to wrong diagnosis?
So do you want me to answer this, or you
Yeah, yeah,
are
please
going ahead with
answer.
it?
Please answer. No, no, you
Okay,
please answer.
so yeah, sure. So as I mentioned earlier, what are the for what situations or the circumstances this telemedicine is appropriate for? I mentioned you it. In most of the cases, it could be appropriate for identifying the general appearances, where it could be certain to diagnose through the virtual facilities. So yeah, that could be one of the con, that each and every symptom might not be clearly understood by their GP by virtual services or the meetings. But still, the diagnosis is challenging, but it is not impossible. That's what I told you. But just remember one thing: there are a lot of cons with this, but the major thing which is making these telemedicine outstanding is it will provide access and quality to the rural areas or the remote areas. That's a major thing you have to remember, and there are a lot of cons like all these things. Yeah.
Okay, next question, Dr. Sai. Will it lead to irrational prescribing, in the sense, will it lead to steroid abuse or opioid abuse? So those sort of problems, will it lead to that?
So I think I also addressed this question. Suppose if you meet your GP in person or inpatient, there might be a higher chance of prescribing a irrational medication or a medicine rather than seeing your GP through virtual networks like telemedicine, because he or you might not think of even getting a medication, or even he might not think of prescribing a medication if you use a telemedicine. So the chances would be very less for the irrational drug use using telemedicine when compared to inpatient services.
What about mental illnesses? Can they be diagnosed with the help of telemedicine? You have any idea on that? Some
Yeah,
wants to.
I'm glad that the participants are so connected with my presentation, and I also mentioned there are especially three specializations that are really taking up with this telemedicine. The first one would be psychiatry, the second one would be gynecology, the third one would be dermatology. So there are, telemedicine is applicable for wide variety of specialties, but especially among these three specialties, it is just taking its leap, because if you consider dermatology, it is very relevant. You can just show up your rash or allergy or any particular skin condition using a video or a photo, and you can forward to your GP. That's the reason. And second one could be psychiatric problems, as you asked. If it's very challenging for bystanders or caregivers of a psychiatric patient to take that particular patient to a hospital or to see their GP in real time situations. But using this telemedicine, they can just leave the particular person as such in their home, wherever they are just staying, and they can make their doctor see them by knowingly unknowingly by the patient. They can actually on their video by using their phone or app, and they can actually show their symptoms, how they are behaving, and what sort of education or any therapy that needs to be given. So it is very relevant. Telemedicine could be very relevant in the field of psychiatry, actually. Yeah.
And one Lavanya was commenting that in dermatology practice, when they see the photographs or the actual, there could be a difference in the condition. Any idea you have on that?
So yeah, as I told, everything has its own limitations.
Plus minus. Okay.
Yeah.
Hmm. Okay, no problem. Next is, what if there are lab tests to be done? I mean, how will the telemedicine person do it?
That's what I clearly stated. Telemedicine is currently being used for
Yeah,
non-invasive, non-surgical, and
non-invasive.
yeah,
Yeah. So probably he'll get the advice to get the lab test done, and then he can show the lab test report
exactly.
through
Yeah, maybe.
telemedicine. Yeah. Then just one or two. So because people are connected to you, let's not disappoint them. Are there
Yeah.
any free open source telemedicine softwares available?
Uh, to be honest, I don't know any specific telemedicine apps or software available in India.
Okay.
But still, I don't think so. We can even expect a telemedicine software to be used freely, because it's like a
Okay.
current thing, and no company will provide you for
We
free
will
of cost.
provide it free. Okay. The next point, just we'll finish it off. How will the PharmD guys or pharmacy people become telemedicine experts? Is there any route for that, or how they can be a part of this telemedicine revolution?
Okay, so excellent. I just conclude my session with this wonderful question.
Done. Done.
Uh, I think participants are aware of what is telehealth and telemedicine. So there's a lot of difference between telehealth and telemedicine. People might be, they might have heard about M medicine or e-health or telehealth or telemedicine. A lot of terminology is being circulated in and around, but there's a lot of difference between telemedicine and telehealth. That is, telemedicine is a part of telehealth. Telehealth is a broader term and broader range, within which the telemedicine is one of its element, where actually PharmD graduates can be part of telehealth rather than telemedicine, where they can actually counsel the patient, counsel on the medications they are taking, and they can even provide drug information services using telehealth but not telemedicine. But telemedicine is a part of telehealth. The basic difference which I wanted to just conclude my session is telehealth is something which is not always related to the medical aspects, but telemedicine is completely related to medical aspects. The difference could be only the GPs could take up the telemedicine task where they can actually see their patient, diagnose, treatment, and prescribe. But telehealth services are like patient counseling, or if you provide any sort of counseling or any sort of interventions or any sort of information to a patient using a telecommunication, that is known as telehealth. So we can make use of or leverage the telehealth services in counseling or providing our drug information services, especially when it comes to pharmacy graduates. So
Perfect.
that's how you can serve.
Yeah, you hit the nail on the head. Thanks a lot, Dr. Sai. You have taken a lot of strain. It must be, what's the time there in Canada now?
It's morning 8:45.
Okay, you have been, I think, virtually from 7 a.m. little with
Yeah.
us. That's why I wanted to finish off the Q&A with you. Okay, so you can relax a little. Thanks a lot, right from Canada.
Any
Yes.
participants have any other questions, they can actually write to me. Yeah.
Yes, perfect. Now I think we'll move to the next presenter. Shall I proceed, Dr. Sai? Yes, to the next
Yep, sure.
presenter.
You can.
Yeah.
Yeah,
Okay.
sure.
Yeah, okay. So it is my privilege and happiness to introduce you all to Dr. Arun Robi. He is B.Pharm, Pharm D post baccalaureate. Dr. Arun Robi, who is a very smart young man, has additional qualification of MSc from psychology, and he is also having a PGDA HHM. He has worked and is currently the assistant professor in the Department of Pharmacy Practice at Narayana Pharmacy College in Nellore. He is called for several guest lectures, so he has a very good profile as a guest speaker. He has attended several conferences and he is member of many societies, including the International Society of Pharmacoeconomic Outcome Research. So he is more involved in this ISPAR activity. He has 18 research publications and he has organized several events too, indicating his organizational ability. Since we are short of time, I will request Dr. Arun to go ahead straight away with this presentation, and we are all ears. Dr. Arun, best of luck. Thank you very much for coming in.
Thank you, sir. Thank you very much for my introduction. I'm highly thankful to Dr. V.B. Narayanswamy, sir, Principal, our College of Pharmacy, for giving me this opportunity. And also, it's a great pleasure to express my gratitude to and sincere thanks to President of Karnataka Registered Pharmacists Association, and extend my sincere thanks to moderator Sri Sunil S. Planka, sir, for your opportunity for this session. I am wholeheartedly thankful and my pleasure to be part in the webinar with a great personality like President Pharmacy Council of India, Dr. B. Suresh, sir. With his encouragement and with his guidelines, I was very much thankful. I express my heartfelt thanks to Dr. T. V. Narayan, President of Indian Pharmaceutical Association, Mumbai. He is my guru. I am a student of Dr. T. V. Narayan, sir. And also he is of my motivation, my guide, my encouragement, everything is of due to Dr. T. V. Narayan, sir. I immensely and wholeheartedly thankful to Dr. K.H. Kudipudi Harnath Baba, Principal, Narayana Pharmacy College, for his support and encouragement for the webinar and all. I avail this opportunity to express my profound, sincere, and deep gratitude to Dr. Sarita Surpaneni, Madam, for organizing secretary for this webinar. Thankful for all for giving me this opportunity to be a part of in this webinar. So I will go directly into my topic. So my topic is of importance and impact of technology and healthcare. The title also, the webinar theme also works on the same. So in this importance and impact, what is the importance and what is the impact of the technology and healthcare? Now everyone is using the technology for everything systems. So every person is dependent upon the technology. No other way the person is depending on the other scenarios, every to the technology. In the playing a role in health is mainly playing a good technology in pharmaceuticals as devices in the system within.
There is some audio and video issue with them. Kindly bear with this presentation. Dr. Arun sir, there is some audio video issue. I think you can proceed fast. Yeah, he's having some audio and video issue. So we'll await his incoming into the webinar room. And talking about telemedicine, I still recollect one interesting incident. When I was talking to a doctor, he was saying to me that earlier Manipal Hospital in Bangalore used to have hardly one telemedicine, that too for second opinion. But today in this COVID-19 session, they are having 500 telemedicine consults every day, 500. And I have an interesting experience. My father-in-law stays in a village called Rady, which is off Bangalore. And in that place, he has some neuro problem. So the doctor is in Bangalore. Normally what we'll do, we'll take a taxi, take him there, wait for some time, and then he sees the doctor examines him, and then the whole process takes one day, and he's quite aged. This time when we had been there, the doctor sent us a link in the WhatsApp. We had to pay the consultation fees through a QR code which he had given. And through that WhatsApp link, which is related to teleconsult, he has examined the patient and he has seen the prescription, and he has also altered the prescription to suit the change in the patient behavior, and he has done the teleconsult very successfully. My father-in-law was also happy, and at the same time the doctor also could provide his service. So telemedicine is happening despite the various, and it's a rural spot where my father-in-law stays. So it is still happening. It is happening in a very good way. I think it will pick up. Like you said, broadband issues may be there, but actually there are certain teleconsult apps which are working in regular smartphone. So that is the beauty of that telemedicine, and it is helping a lot, especially for the elderly aged subjects currently COVID situation. So that is one of the important points. We'll just wait for him to come back. Otherwise, we will see how to proceed further. And another issue about this telemedicine, which I got to know, is in Varanasi. Because I am in marketing, I keep in touch with the market happenings and the micro and local trends. So one doctor I know, this lady is a very leading dermatologist. You were saying that dermatologists are using a lot of teleconsultation, which is true. In Varanasi, the one pharma company has come and set up the entire teleconsultation unit inside the home for her. And then various peripheral areas, people are doing teleconsultation of the dermatology, this thing. So that way also it's happening in a place like Varanasi. So that is a very backward place, and it is happening successfully. Dr. Arun, okay, he came and went. Okay, so these are
Yes, sir.
okay, Dr. Arun. There is an audio video issue in your this thing. What I suggest, you put the video off, okay, and then you speak fast, okay. And now you continuously speak. I will keep silent. You please keep fast. Yes.
Okay, sir. Okay, thank you. So this emerging technology. So how the emerging techniques work in India? There are nearly in medical apps now using is over 19,484 medical apps now using till today. 23,728 healthcare and fitness apps are using. Those are the most probably depend where the healthcare system is mostly depend on the apps, the medical apps, the how working, the mechanism, all the people are mainly depend upon the healthcare system is depend upon the medical apps. Apps for even a simple health issue or the simple mechanism, they are working and they are monitoring on the system and the scenario, how the effects.
Again, I think he has run into an issue, Dr. Narayanswamy. What we will do, we will just try once more and then we will take a call. Are you there, Dr. Arun? I think he is having some major issues with this audio and video. It was okay when we did the trial. But
when mechanism plays a key role in the effective mechanisms, how the apps are working, or the role, the regulation, the system will be mostly depend upon this one. See, this is the room where the people are using mostly about the healthcare system is mostly depend upon the usage of devices. See, in the doctor's office, 16% of device usage was observed, and out of the town 20%, and visiting friends and family 23%, at work 27%, and at home it is of 61%. So people use their mobiles to research about the hospitals, going for the hospital, and finding out the health systems mostly depend upon the medical devices only. So this is of the healthcare is a top mobile category usage. So here we can see here the 6% of the people mostly uses the whole purpose is for only healthcare. That is particularly about finding of the drug for the usage. Even today, out of 13 billions of people, nearly 8 billions of people, 8-9 billions of people are searching for the medicines for COVID-19. So mostly they are depending upon how the medicines are using, how the drug finding out such criteria was mostly depend upon the healthcare systems. It is mostly how even the mostly fitness, the food and everything is depend upon the. Coming to smartphones usage in the examination room. The examination room is the physician's room where the physicians are going to examine. Personalized healthcare providers use smartphones during patient consultation. Physicians use nearly 40%. RNS residents use 60%. And associate residents will use up to the 65 to 70%. Physician assistants use mostly up to the 73.5% nowadays. Mostly these are the statistics of 2012, but coming to compared to by 2020, 100% of physicians and 100% of all the people of the healthcare professionals depending upon the examination room mainly depend upon this. This is a big data where the people all depend upon the technology. So even in the recent days, current scenario, the doctors or the patients has to go and collect the films for the X-ray confirmation. But nowadays, by using the mobile devices, we can confirm, we can examine the effect, how we can go for the analysis. See, this is of the device mobile. Here we are seeing the X-ray. We can see here the jaw, lower jaw. Here we are seeing the thyroid examinations. Everything is depend upon the technology. Now the technology, this comes as of mobile diagnostics. So this is of eye examination. These are the devices. This is the device which is used to perform the eye test by measuring. There is of no need going for the ophthalmologist to confirm how the eye, anything damage to the eye, there is of no need to go for an examination. This is of the heart monitoring machine, which is of a wireless communication between app and your phone. So we can find out the how our heart monitoring, how the heart rate is, how the regulations of our heart rate. This is a very much easy to find out and to know how the changes can be associated. So this is of the ear view. This is of cellscope, which is used connected to a digital otoscope. These are very useful to find out any infection is there in your eye, any inflammation, any CSOM is there, any damage to the inner or any damage to the tympanic. Up to the tympanum, we can find out the damage of the ear can be found. So any changes to the inner ear, all the things can be found out. Each one is of glucose management, vital statistics testing. These are of the useful. So this glucose management and the testing devices are most used to find. So how these are, so recently there is no need to go and giving the blood sample. Already we have thermometer available in hand. Now, even if you are in the journey or another device, this vital statistics testings or this mobile device is mostly used to find out how this will be. This one is a tetrahedral. So by using our phone, we can find out the system, how we can scan our fingers, we can scan our how we can approach the system, find out any damage in our body. So this is of the near field communication. Now everyone is using the near field communication. So which is used to measure the temperature, which is used to monitor outcomes, and it is plays a key role. So so showing our body mechanisms, means how it is working, what is the criteria, and all can be found out by this near field communication. So next one, we can go for the NFC heart monitoring. So rhythm track. So if any person is suffering with any heart complications, then it can be device send the information to the doctors by the near field communication. It sends the information, whatever the information required, the information has to be sent to the doctor by this communication. This one is field mapping. So this is a direction list. So the direction list, or the direction where we have to go. So this is of the mostly used in Australia. So this is mapping, the right there is a foot. So this is a device where the person is here and the person has to reach this place. So what is the shortcut way without interacting with other person we can find by this thing. So next one is of Google Indoor Maps. This is of American Museum of Natural History, where the people can use this one to get the information, get the shortest distance. So the long distance can be made into short by using the Google Indoor Maps. So coming to this one, mission to mission. So how the people can be. So this mission to mission, this one radio frequency identification devices, which are mostly used in the hospitals for wheelchairs, beds, cardiac monitors, etc. So when any complication, the staff can easily locate. The staff can easily come to that point of time and can easily go for treatment or any emergency. It will be very much useful. So this is of the England hospital, very much highly first started the RFID technique, and now it came into India also. Now the AIMS is also following the same, and some of the hospitals in a south region also following this technique. Radio frequency identification device technique was mostly used. And next one, this technology is also in the X-rays. So this is of X-ray imaging. Within a simple shot of a computer screen, we can find out the fluctuations, what are the changes we can find out in the change. There is of no going and removing of our shirts or clothes and lying on the bed. It is of not the possible thing. Only thing is of mainly based on the mission. The screening of the computer can scan everything, whatever the requirement conditions. This is the connected form within. So it is of a smart pill, which is of a wireless pill, which is attached to our body, which you can interact, which you can found, or which can regulate the microelectronic receiver, which can get the patient whole information. The whole information of the patient can be transmitted to the physician or the person who is in need. It is of approved by the FDA, and it is also approved by the WHO. It is of now using Novartis company. It is mostly used in developed countries. US was mostly using this signaling. This pill. Now India also getting the pill to be used. So this one is a pick knife. Instead of sending the tissue to a lab and waiting 30 minutes before surgery, this knife is used to find out what the effects. These are of wearable and embedded devices. These devices will be works. How many steps the person has took, how much energy, how much he converted his energy into calories, how many calories he burned. These are the fuel banks, the sleep patterns, everything we can find out by this system. These are of Jawbone setup. This is used to provide and predictive the recommendations for healthier living. So these healthier livings will be mostly placed. So how these mostly plays the effective role, and the mechanisms will be highly utilized in the system. Next one is of coming to this. This one is also mostly the recommendation for healthier living. Next one, this is of the one of the doctor who introduced this one, CPR. Already we know called cardiopulmonary resuscitation. So only healthcare professional know about the cardiopulmonary resuscitation, but remaining other people don't know about the cardiopulmonary resuscitation. By using the app, by using the glasses, we can go for the performing of the cardiopulmonary resuscitation in a proper way. So this one can analyze how we can perform the CPR, how the person can be to the normal. So these are the glue glasses used to find out, emphasize the safety and importance of the confidentiality, and information transforming can be found out by this. So these are the lenses. So these lenses also technology used now for finding out the prototypes. So these are the biosensor tattoos which can use it printed directly on skin to bind. So next one is of the, it can detect the things like temperature, so hydration levels, and that showing and swimming. The tinning of the circuit lasts on your skin for 2 weeks. It can be used for 2 weeks, then it can be extrapolated and it can be used. So then we can find out the changes associated with this. Next one is the wellness apps. So wellness apps are mostly used for the finding out how the system of the body mechanisms, how the body functions are working and all. So this is of the mostly used the tracker, that is of bedded sleep tracker. So it is a wellness device which tracks your breathing, snoring, movements, environment, and sleep patterns of our sleep. Normally nowadays, no one people falling asleep with the normal conditions. This will find out how much our sleeping is. So next one, facial recognition, digital mood detection. So how our mood is, how detected by this. See, this is the mood detection app which can be detected our mood. So how our mood changes. It is a most useful system sensing and the face expressions of the person, volume of the voice, emotional states, and all can be found out by this mood detection. So mostly well played detection in Canada as well as in US and Australia. In much more countries, nearly 70 to 85 countries are using this mood detection. So based on the mood detection, they are suggesting some sessions for either yoga or some other natural remedies or some other it will be followed. So this is of the gesture, this one is of gesture recognition, how this recognition of the scannings and all. So next one is for kinetic surgery, how the surgery will be played. So this is of the spine, utilize motion sensors and was detected in surgery. So for coming how the surgery has to be done, how the device adjustment in the body will be confirmed by using the scans during imaging. So some physicians will give guidance to the systems to maintain, to regulate the physiology. Next one, lip motion. So it is of a gesture tracking system, more powerful, more accurate, smaller and cheaper than Kinect. So I am very much more close. Already Suresh sir also conveyed about the 3D print technology, very vast technology, very mostly playing a key role. I'm coming to the close. So 3D printing technology is a very much most widely using for preparing of tablets or devices or the organ in is similar to the same. So this 3D printing technology and bioprinting plays a key role. See, this is of the 3D printing technology which allows doctors and scientists to print synthetic tissue and entire human organs. They will be loaded with the cartridges of primary or other living human cells and move in 3 plants, allowing it to fashion and to design. So it is working very much highly. Even so many tablets are coming in 3D printing technology. So this is of the in China researchers printed a technology, and the mechanisms are playing a key role. So thank you. If any questions, you can.
Yeah, thank you, Dr. Arun. I think it's getting late, but nevertheless,
Okay, sir,
Lavanya wants to know if the embedded devices are they going to show accurate results or not? That is the concern. Accuracy of all
Actually,
these.
embedded devices normally accuracy instruments will show 99% of accuracy. So devices like mobile devices does not show that much. It is of 80% accurate.
Yeah.
So
Okay,
the instruments
good.
which are using for health purpose like CT, MRI, those are very much good enough to show the result.
Yeah. Good. Okay, thank you. I think it's high time because we have already crossed the limit of usual time scale. So now what I request is Dr. Sarita to come in. If she is there, she can propose the vote of thanks and provide the closing remarks also. Can I request Dr. Sarita ji to come in? Yeah, please. I think you are not audible, madam. Yeah.
No, you're not audible.
You're not audible, doctor. No, no. You please put on your audio. It may be off. No, ma'am. No. Please speak. No, it's not audible. No.
Not audible. Unmute audio.
I think there are some basic mistakes there. What I suggest, Dr. Narayanswamy, sir, you please do the needful and we
Yeah.
will close it because it's high time. It's already 7:40.
Okay, sir.
Please, please.
Hello.
Yes, please continue, sir.
I am audible?
Yes, yes, you are audible, sir. Please continue.
Okay. Hello.
Sir,
Sir.
please, somebody again touched some wrong button. Okay, quickly close it, sir.
ಆಗ್ತಾ ಇಲ್ಲ. No audio. Okay. Okay. Now it's.
Now it is audible, sir.
Yes,
yeah,
ma'am.
audible.
Very clear. You please do the thing.
Thank you, thank you. I'm very sorry for the inconvenience of me and Dr. Arun, because Arun sir also tried a lot, I think, to connect because of maybe it is raining outside and there are a number of problems which I'm not able to address properly. Anything it might be. I'm not going into the issues, but I'm really sorry for that. Here, good evening, everyone, and thanks for your precious time. And you have waited for long, and I'm just closing. It has arrived to closing time. At the end of the webinar, I would like to say many thanks for all your effort to participate in this webinar, and I'm really convinced with the most of the valuable outcomes of this webinar, as Suresh sir has emphasized on important one, which is 4 industrial revolutions, which is upcoming health, pharmaceutical technology, which is mainly leading us towards artificial intelligence and machine learning. This is very important point, I think. And the second one is very important towards what, why, and how telemedicine is, as Dr. Sai has emphasized this point, and articulation of the process of telemedicine, which students can learn a lot from this. And the third one is understanding the importance of technology during the COVID-19 pandemic. This is what Arun sir has tried to emphasize, but it was a bit disconnecting. And emerging new techniques with detection, diagnostic, treatment, and many surgical procedures and so on, which has been useful. And evaluating the upcoming trends. Actually, students need to understand the concept and just need to know many apps, how many it is useful for, which are useful in the daily life. And at last, I would like to remember the sentence of Dr. B. Suresh, which has been stressed very importantly, how much the pharmaceutical technology is growing, and the precision medicine and emerging medicine and repurpose. He has made a point of repurpose and reutilization of medicine like hydroxychloroquine. And the next one is blocking change and 3D printing. So these are the important points which sir has talked about today. And the observations, the main, as being a pharmacist, we need to observe everything, what and all the changes are happening. The observations plays a key role in our pharmaceutical technology and pharmacy profession, and we all are here for responsible for the quality of profession, and which is a really quality telemedicine or whatever the medicine it might be. If the quality is there, it will run in a long run, I think. From RSCP team, I wish a very big, sincere thanks for coming to the webinar. Thank you so much for the opportunity. And I'm really thankful to everyone.
Thank you very much. It was very kind of you.
Thank
I
you,
think
sir.
we'll call it a day, right?
Yes,
Right.
yes, sir.
Thank
Sure,
you.
sir.
Thank you. Thank you very much, Dr. Sai and Dr. Arun. Okay, best of luck. Right. Thank you.